Hi there. I'm Mary Ellen. I'm going to be your tour captain for today, representing Office of Career Planning as we go out into the world. Today we are going to visit rehabilitation services in South Deerfield, Massachusetts, where I will be interviewing Lisa Bostrom. Not only is she an occupational therapist, but she is a certified hand therapist, which is an amazing specialty. So let's put those pants on, leave our house, and go off into the world, people. Let's move.
Lisa Bostrom has kindly agreed to let me interview her today. So this is Lisa's fun occupational office, and I will turn it over to her. Hi, Lisa. Thanks for
Hello.
joining us.
Thank you for having me.
So if you could just share your name, which we know, but where you went to school, the degrees that you hold, and what we should know about how to become an occupational therapist.
So when I went to school way back when, I graduated with an undergraduate degree from Springfield College in Bachelor of Science called Rehabilitation Services. When I was getting out of high school, I wasn't sure if I wanted to go into PT or OT. So like many other students, that was a major that was available to us to allow us to explore both of those avenues and determine which one we wanted to choose from. So I ultimately made the decision to go into occupational therapy, and at that time, most of the programs were bachelor's programs that were shifting over to master's degrees. And I had applied to a bunch of different colleges, and I ultimately decided to go to the University of Hartford for a second bachelor's degree in occupational therapy. That ended up being an additional 3 years after my first undergraduate degree from Springfield College. It was 2 years of classes, and then it ended up being about 9 works of field work in a mental health setting, a physical disability setting, and then a specialty setting, which I chose as hand therapy. Nowadays, most of those programs are now switching from master's into doctorate programs. And there are still a couple of tracks that people can go through to get to that degree. I know STIC offers a certified occupational therapy assistant program, and they also have, I believe, Elms College, and there might be a few others in the local Springfield area that offer a bridge program that allows students to transfer into their program to then continue on into becoming a doctorate in occupational therapy.
Awesome, thank you.
Mm-hmm.
And so, thinking back to when you actually had to make that decision, was there something, did you have like an aha moment, or what made you believe that, like, yes, this is the career for me? And how long did that decision take you?
Well, I've always had an interest in orthopedics, so that's kind of why I was trying to figure out whether I wanted to go into PT or OT. I had the opportunity when I was at Springfield College to meet a fellow alumni of the college who had graduated with her occupational therapy degree and was a locally practicing hand therapist in Springfield. So she offered me a chance to shadow her and see what exactly she does as a hand therapist. And that was the beginning of my senior year at Springfield. So I took her opportunity during the fall semester, shadowed her, and it pretty much was instantaneous that when I saw what she was doing and the type of injuries that she was working with, that was what I wanted to go into.
Awesome. Could you describe any roadblocks that you might have been challenged by, or maybe moments of doubt along the way?
Well, like many seniors, when I was in high school, I really was not quite sure what I wanted. I'm sure it might have been a little bit more helpful if I had an opportunity to explore while I was in high school those types of settings. I had no idea that hand therapy was even a thing, let alone occupational therapy. So when I had that opportunity in my college years, that certainly helped at least narrow the gap down to what I wanted to do and get into. As far as other hurdles, really it's just a matter of making sure that you had decent grades to get into the programs, because at the time that I was going through, it was highly competitive. I don't know if it's the same now, but I would imagine there's still a degree of competitiveness that you need to have a certain GPA etc., to be able to enter into those programs.
Awesome. Could you describe a typical day for you? I know usually busy is always at the top of your list.
Yes. Um, it's interesting. I've had the opportunity over the course of my 20 plus years of doing this to work in 4 different settings. My first setting was in a outpatient hospital-based program, and I did outpatient, inpatient, and home care. Then I worked for a private physician, a hand surgeon, so I was a private practice there. Up until about 6 months ago, I was working in a corporate outpatient clinic, and then now I'm back into an outpatient clinic at Cooley Dickinson. And the days that I've seen patients on all of those settings is quite variable. So it really depends on the type of setting that you are working in. Right now, my typical day, I see 10 patients a day. All of my patients are one-on-one. So I'm not sharing the table with any other patients or sharing time with any other patients. So 10 patients is a full day from start to beginning. And most our sessions here are about 45-minute sessions, and that includes the same for evaluation. Sometimes clinics, other settings will have a different time frame for evaluations versus their follow-up treatment sessions. There are also different settings where they desire or highly encourage you to see more than one person at a time. So being in this setting, I definitely have that, what I feel is a very desirable schedule of only seeing one person at a time, because most of my time when I see these patients with orthopedic hand injuries, I need to be with my hands physically on them, and it's hard for me to do that effectively if I have to bounce back and forth between individuals.
Awesome. And if you could just tell us a little bit about what is the absolute best part about your job?
When somebody comes in with whatever they've decided or determined to be a catastrophic injury or a very debilitating injury to themselves, it can be anything from a broken wrist or a multiple bone crush injury, tendon lacerations to a hand, and they come in with this big swollen mitt of a hand. But when a person comes in and they're clearly at ends with their functioning of their hands are their tools. Their hands are what allow them to be independent and to do the things that they want to do day in and day out. So when they come in and not able to use their hands at all, sometimes, or in a most often very limited manner, by the time they leave here and they can actually make a fist and they can resume at least self-care activities with little to no issues, and just seeing the gratitude on in their faces and in their actions, that they feel that they can be the person they were before this injury and that the injury is not going to consume them anymore. That's one of the most gratifying parts of my job, knowing that I was able to help them achieve that.
Awesome. And I can say from a patient point of view, it's pretty damn awesome.
Thank you.
Is there a least favorite aspect to your position?
Oh, the paperwork. The dreaded paperwork. There's just sometimes not enough time in a session to get all of the paperwork done, and you'll find that with a lot of clinicians across the board, no matter what setting they're in, that our time slots don't necessarily always allow for all of our documentation to be completed. So most often we'll either come in early, work through our lunch break, take it home. If that is an opportunity, you can take it home with you and do it on the computer at home. But the documentation is definitely one of the toughest hurdles and problems that we as therapists have to contend with.
I imagine so. How have advances in technology impacted this field, and where do you see it heading in the future?
For me, I can say I would expect a lot to become of the 3D printing option. I feel like that certainly has a place, or could have a place, in the world of hand therapy for the splints that we make, or even assisted devices that we can use to help people become more independent in their daily functions if they have a hand issue that doesn't allow them to function normally. So I do think it's coming. It hasn't completely gotten here, but there are certainly things that are leading up to that point where it becomes more prevalent in our everyday lives as hand therapists. Certainly the Zoom feature has been great, especially during the pandemic, for those patients that don't necessarily need as much hands-on time. That has been helpful because I can see directly what the patient is looking like when they do their exercises, make sure that they're doing them properly, and also see what the general appearance of the hand is looking like. If I'm concerned that, hey, that looks a little more swollen than it did last time, or that's not moving the way it's supposed to be, that certainly has allowed me to have a better handle on those patients that either don't want to come into the clinic for the health reasons, or don't necessarily need to come into the clinic for as much face-to-face time for their treatments.
Awesome. 2 more questions.
Sure.
What advice would you give someone who's considering going into this career?
Shadow as many different people as you can in as many different settings as you can, because like I said, the way that the appointments are set up and the expectations of each clinic are very different. So it will give you an opportunity of what hand therapy is like in different settings.
And just thinking about the 4 different places that you work, do you feel like there is mobility within occupational therapy to find kind of like your best fit within the field, depending on the office?
Yes and no. I think a lot also depends on the type of location that you're in. Here in Western Massachusetts, we are somewhat limited in our availability for hand therapy. Not a lot of places offer it. Speaking right now, I am the only hand therapist in Franklin County right now who is a certified hand therapist. So I think a lot depends on the geographic location and the urbanization, so to speak. You know, if it's a highly urbanized area, most likely you're going to have the opportunity to have different opportunities for clinics in different settings to occur. Whereas here in Western Mass, you can be limited, and you may have to travel to get to a place that will provide hand therapy.
Awesome. Anything else that you want to share to someone considering the field?
Reach out, talk to a hand therapist. I'm here. You can talk to me. I can help you with any other information, but if it's something that you're interested in, I would highly recommend at least doing some volunteer time to just observe. Some clinics are allowing that, some clinics aren't with the COVID. Again, you'd have to check with each location independently because the answers will vary across the board. But if you have the opportunity to shadow, I would do it as many times as you can in as many different settings, because that will really help you understand a little bit more about what it is that we do and the different types of injuries, the splints that we make, the type of patients that we see, and that can certainly help you say yes or no to that as a career.
Awesome. On behalf of all UMass students watching this and any other random person, I sincerely thank you, Lisa, for your time.
You're welcome.
This is going to be a slow, rocky view of the very fun occupational therapy toys and instruments that Lisa uses to make her clients all better. Okay, signing off from the Office of Career Planning. Thanks so much for joining us. Bye.